Hello and welcome to the Community Voice. I'm Fara Sax. Digestive health affects millions of Americans every year, and colorectal cancer remains one of the few cancers that can be prevented through routine screening and early detection. Joining us today is Dr. Christian Andrade, a board-certified gastroenterologist, vice president of GastroMed, and the University of Miami trained physician who specializes in advanced endoscopy, colorectal cancer prevention, and complex digestive disorders.
Hello, Farah. Thank you for having me.
Thank you so much for being here today. It's such a big topic. It's so much to cover in our 30 minutes, so I'm really happy that you're here today.
I'm happy to be here, too.
Tell me a little bit about your history, how you came to be the vice president of GastroMed and your evolution to be a doctor.
Well, I was born and raised in Miami, and I went to high school at Belen. Thereafter, I went to the University of Miami. And growing up, the medical field always was something that I was interested in. And during my medicine residency, I focused on the procedural type of specialties, and gastroenterology always appealed to me. Seemed like everybody had some kind of GI issue, and I felt like it was something that I wanted to do to help people. And I joined the group about 10 years ago now, 2015. Since then, it's been a great ride. We've grown a group of 5 gastroenterologists now to 16. And during that time, we've been the owners, the leaders of the practice. So that's helped shape the way that we practice and that we treat patients, being able to control the way that we manage our business and the way that patients see us has been very helpful, I think, for the community.
I really want to hear about your training, your education. So when folks are looking for a doctor, they really feel secure and comfortable about going to GastroMed to see you and maybe some of your other colleagues. Talk about the local education, because you were raised here, you were educated here, and you're practicing here.
Right. So I was raised here, and I went to the University of Miami, and my roots are Cuban-American. My parents have a restaurant, and I have been always part of the restaurant business. And so I've always felt very connected to the community in the same way that my parents have been. I feel that GastroMed is also that way in many senses. So it started off as a family kind of business with the Velosos and the Sobrados. So those are 2 families who got together, and father and daughter, and father and son, who started GastroMed. And I was really one of the outsiders that came in, as well as Dr. Vargas, and that's when the group really formed. And it appealed to me because it wasn't owned by private equity or outsiders or business people. It was owned by a family, and they were like the underdogs. And they really wanted to be able to control all processes in order to be able to give patients the care that they felt that they needed, not governed by price or profit.
And like one of the things that is one of the models is the compassionate care aspect of the practice. Can you speak to that a little bit?
So every patient is an individual with their own personal cares and wants and needs. And we fortunately are able to do everything in gastroenterology from A to Z. So from the moment the patient calls, and we respect who they want to see, we respect their concerns. Many times people are worried or scared of things that are very simple and to us are simple. And sometimes they underplay the things that are really important. So it's our role to guide them and help them find their way and treat them if there's something that needs to be treated. And many times it's not a physical ailment. Many times it's rooted in psychology. So there's a lot of interplay between the mind and the GI tract.
I think that's really an important topic, not to just move to the next topic. Let's delve into that. What does that mean? Because there is a lot of gastro problems, gut problems, and we're treating it. You're treating it. But what do you mean that the mind and the stomach connection? What does that mean?
So there are actually more neurons in your GI tract than in your brain. So there's a big interplay between the way that you feel and your psychiatric well-being and what's going on in your gut. That affects movement. It affects the type of bacteria that are there. It's a area of research that we're still delving into, and hopefully in the future we'll understand better and be able to maybe use medications that are for psychiatry in conjunction with our usual medications to improve GI tract issues, especially along the IBS route.
And is this significant for just the gut, or is other abnormalities or disease come about because of the brain, or is it just strictly because of the gut response?
So there are associations between the brain and multiple other disorders. Definitely pain, for example, is something that is augmented by anxiety and stress. Anxiety and stress has also been implemented in multiple autoimmune disorders. So there is definitely a role, and in the GI tract, Crohn's disease is often associated, and crises, the patients will tell you that they had some kind of event, life stressor, that may have been associated with initiation of the disease or with crises. These are things that are still being teased out and not really clear to us just yet.
And that's very, very interesting, because there's such a mind-body connection that we often forget about, and sometimes a pill is not the answer, but is to deal with what's going on inside of us, literally, both our gut and our brain.
Right, exactly.
What does it mean to be a board-certified or board-eligible gastroenterologist, and why is it important for patients seeking care?
Well, you want to have confidence that your doctor met some kind of standard, and you're not just speaking to an internist who is calling himself a gastroenterologist, or someone who is not trained at the standards of the American College of Gastroenterology. And it's important for that reason primarily. If you do not meet that standard, then you need to question why that's the case, and why you would want to see somebody who has not met a standard that's relevant to the community, relevant to the hospital. Hospitals require, for the most part, board certification in order to work there.
And how does GastroMed combine advanced technology with clinical expertise to provide really high-quality care?
So we are pretty much at the forefront of technology. We have the latest equipment when it comes to visualization, our endoscopes, colonoscopes. We are always trying out new equipment. We recently were at DDW, Digestive Disease Week, and we promoted ourselves and had a chance to look at the new equipment and new tools that are being invented. Every day there's something new. Some things pan out, some things don't. New snares, new tools, new devices to lift and resect polyps, new technologies for diagnostics, for stool studies to look at the microbiome. There are lots of different things out there that are constantly evolving. Science is trying to catch up to the inventions, really. People are kind of outpacing the data. But it's important to be there so that when things are ready to be received and accepted, you're able to apply it to your patients.
You mentioned microbiome. Let's talk about that. What is it, and how does it affect gut health and health throughout the body?
So everybody has a distinct, almost like panel of bacteria that are commensal or live within their GI tract. And that surprisingly doesn't change too much throughout lifetime. It's almost as if there are handshake agreements between these little cells that are aligning the GI tract and the bacteria, and they are allowed to be there in certain proportions. And when they are there in abnormal proportions, disease tends to happen. So it's kind of hard. It's kind of a chicken or the egg kind of thing, because sometimes we don't know if the disarray or the imbalance of those was something pre-existing. And if you were to try to improve or balance it out, will it be long lasting? So in studies where they try to improve the proportions or do gut transplants, fecal transplants, there is improvement in that balance, but it tends to kind of stray back to the original microbiome, the original proportion of bacteria and types of bacteria that the person was kind of born with.
There's a lot going on with probiotics, prebiotics, growing your microbiome, making it healthy, make it balanced. What's that all about?
So the initial data with the prebiotics and the probiotics seemed promising, primarily for gas, bloat, diarrhea, and thereafter larger, longer studies were performed that weren't as positive, let's say. So it seems like the introduction of those bacteria, like I mentioned, may help in certain cases, but in order for that to continue, sometimes you have to indefinitely take that medication, number one. And number two, it doesn't help everybody the same way. And the robust studies that were done were not as positive as the ones that were done previously, which were smaller and not very highly powered. So it seems like all that fervor for the probiotic, at least on our side, has died down a little bit. And we're waiting for more data to see if particular drugs and medications and fecal transplants may be the key in the future. So
there's kombucha, there's fermented food, there you go on to sauerkraut. Yes, no, maybe so.
Yes, no, maybe so. It's exactly what it is. So we don't really know which ones for what people and really for what diseases. Unfortunately, that's really where we're at with the literature. And because the GI tract is difficult to study, and it needs to be studied in a controlled way, it just hasn't been done. And I'll say it because there's not much money to be made when something cannot be, what's the word? If you can't put it in a pill. So if it's really just kombucha or eating healthy or eating certain things, you can't really market that. So there hasn't been the kind of study fervor as you do for chemicals or drugs, because you can have a patent on those, and you can't have a patent on a diet. So that's kind of limited, I think, in a way, some of the dietary studies. There just isn't much money.
It's very, very frustrating then for our audience that might be suffering, that are watching us today. A couple of people in the room have expressed before we began our interview. So it's like a catch-22. So what are people supposed to do when they've gone through the tests and they're still feeling what they're experiencing?
Yeah. So if which tests are you referring to? If you're referring to, there are some microbiome tests out there which are not FDA approved. And I get these all the time. Patients show up with a panel of these are your bacteria. And then there are some suggestions. And usually it's you got to pay a certain subscription to get a certain dietary advice or something like that. So on our side, for the most part, we don't have much data, or we don't have something to support those findings. We don't know what to do with that information just yet. So this is one of the things where the findings are outpacing the data, and we don't really know what to do with that. There are many people out there who will tell you what to do with it, and if you pay them. Scientifically, we don't have the data yet to support specific probiotics, specific diets when it comes to the microbiome. It's coming. It will happen. It's just been slower because of the financial reasons I mentioned.
And I really appreciate your honesty on that, because more data is what we need, is what I'm hearing you say. But there is concrete things that people that need to come to a gastroenterologist. And what symptoms? We talked about that. Things that to be ignored. You said that earlier, and things to really take heart and take action.
So what I tell anyone who asked me, because everywhere I go, I was just in the Florida Keys, and I had multiple questions from random people. When they found out,
I'm wearing your shirt.
No, somebody said something, and then he's a gastroenterologist, and everybody's coming asking me questions. So
if you were a heart doctor, they'd tell you, cardiologist. Here we go. Yeah. So you're just lucky. At least you aren't a gynecologist, right?
Like everybody. But anyways, so what I tell them is, if you're worried about something, your first stop is your primary care physician. So you need to go see your primary care physician, and they're the ones who should really decide whether this is something that you should worry about. GI symptoms are common, but if you are worried about something in specific, you should see your primary. The red flag symptoms that definitely need to be evaluated are weight loss, difficulty swallowing, rectal bleeding, changes in bowel habits, abdominal pain that wasn't there previously, unexplained, those kinds of things, anemia and other laboratory abnormalities. Family history is also an important factor, and the patient, along with the primary care, can decide whether it's time to go get a colonoscopy. Yeah.
Colon cancer screening. What age do you start?
So for the routine population, it's at age 45. So men and women, age 45, unless there is a first-degree family member under the age of 60 who either had a colon polyp or colon cancer, then it's 10 years prior or 45, whichever comes first. And
what would you say to someone that's been putting it off, that's nervous, that's scared?
Well, most people want to self-preserve. So there must be other things they're doing. If it's a woman, they're probably doing their mammogram. They're probably doing their pap smear. So when I say to women who are putting it off, who are of those ages, I'm like, do you do your mammogram? And then I ask why. Because if you're doing your mammogram, you should be doing your colonoscopy as well. You're more likely to die of colon cancer, since it's the second leading cause of death in the U.S. over the age of 50, than of breast cancer. Now, to be clear, 1 in 8 women will have breast cancer. So you're more likely to get breast cancer, but you're less likely to die of that, more likely to die of colon cancer. Breast cancer is one of those where you can actually feel sometimes, not always. You want to catch it early, which is why you do a mammogram. So then I say, if you're doing a mammogram, you're doing it because you don't want to wait to have a mass. Well, imagine inside your colon, by the time you realize there's something wrong, it's too late. And even if you come in for a screening colonoscopy, there is a small chance you could have a colon cancer without any symptoms. So, and that happens to us once a month at least.
So are these like red flags of polyps that are being found? Is it bleeding? How does it manifest and show after it's been diagnosed? Or I'm having more symptoms now, but I didn't realize it was X, Y, and Z, and now I have colon cancer. Is that how that works?
Yeah. So the most common symptom that people come in for that they're worried about cancer is rectal bleeding. And rectal bleeding can be anything from hemorrhoidal to related to a polyp, in any one of its progressive stages to colon cancer and colon cancer itself. Changes in bowel habits, constipation, or diarrhea can be somewhat of a late symptom of colon cancer because you have to involve a significant amount of tissue or obstruct. And anemia as well, it would be one of the symptoms or one of the findings that may suggest a polyp or a colon cancer.
The digestive health is such a sensitive topic for a lot of people. How do you and your team create this feeling, this environment where patients feel heard, respected, supported, and to ease them? Because it's a very disheartening, and it's not you're very vulnerable.
Mm-hmm. So I think it starts with the phone call. So we strive to pick up the phone and to hear the patient and to hear their concerns and make an appointment as soon as possible. We do have next day appointments for patients who are really concerned. And we strive to have that 24 hours. If it's a Friday, it'll be a Monday. And it starts there at the initial phone call. And then from there at the front desk, with the medical assistant, with the doctor. So we try to be as human as possible with the patient and understand at some point, someone in our family, regardless of how much they know about medicine, we're at that point and worried about something. So it's meeting them at a one-to-one, having a human connection, talking to them openly, and allowing them to express their concerns.
And that's, people want to be heard. I think that's it. And I think this personalized treatment that you're talking about really addresses this.
Exactly.
What sets GastroMed apart from other gastroenterologists in South Florida? Because you have many locations. You have 8 locations.
That's right.
You have 4 surgery centers, 16 board-certified physicians, 2 specialized pathologists. That's like a lot going on in this practice.
Yeah, and we've done that in a short period of time, and it's been quite a feat to do that. It's been a lot of work, but we're proud of what we've done. We're happy we're able to do it for the community and keep it physician run, which I think that's what sets us apart from other companies. We don't put profits over patients. We strive to meet the patient at their level and make them feel good and take care of them as fast as possible. We're a one-stop shop for all things GI. And
I love that one-stop shop.
Mm-hmm.
Wow, one-stop shop. I love that. Fuel and leave, right?
There you go.
And you're growing and expanding into other communities. Miami Lakes is up and coming.
That's right.
Very, very exciting. Let's talk about that, what it means for patients regarding access to their care.
So this is the first time we're expanding towards Broward, so towards the north, and we hope to continue to do so. We will, at some point, also develop access to surgical centers in the Broward area. For now, we're as north as near Doral in the Flagler ASC. That's as close as we are north, and as south as Homestead Exit 1. So we're pretty expansive when it comes to outreach to the community.
A couple of things here. Colorectal cancer is the second leading cause of cancer-related death in the United States, according to the American Cancer Society. Talk a little bit about that. Yeah,
we don't know what's going on. In the last month, I've had 2 colon cancers in people under 30. So it's pretty scary. It's unclear if it's environment, what people are smoking, what people are drinking. It's concerning to us. We don't know exactly why it's happening, and it goes back to that point. If something is happening you don't think is right, don't ignore it. Go see your primary. Go get checked out. And if you have any of those red flag symptoms, you need to see a gastroenterologist, and we can decide whether colonoscopy is appropriate for what you're feeling. It's an alarming thing. We don't have the answers just yet. It's currently under study. I have my own guesses or concerns as to why, and it may be dietary processed meats. So the usual stuff that in the past has always been associated with colon cancer has been obesity, alcohol, tobacco, processed meats and nitrites, such as in salami, hot dog, and burned meats, barbecue, smoked, that kind of stuff.
Yeah, I remember reading once it was, don't have hot dogs because they have the nitrates, and it's because of the charcoal that it's... Yes, no, maybe also?
That's true. So it's considered class 1 carcinogen. So processed meats are on the same level as class 1 carcinogens, at the same level as H. pylori-associated gastritis. So you need to treat your H. pylori if you have it, get it eradicated.
Talk about H. pylori, since for those that don't know.
So
like that little happy little bacteria.
Yeah, that happy bacteria that makes people unhappy. It's pretty common. It's been around for a long time.
How do you get it?
It's associated. So that's a great question.
They always ask you, did you travel abroad? Did you drink the water?
So you're not going to get it from saliva, probably not going to get it from water. To be honest, I've talked to infectious disease doctors. We're not 100% sure exactly how it's transmitted. So it is not a normal contact thing. It is in the stool, and we think it's contamination from stool to mouth. So maybe in your groceries, the raw vegetables and all that may be contaminated from wherever they may be coming from.
Oh, that's like a big thing. That's a big hot button now.
Yeah, the cyclosporiasis.
Oh, yeah, that's like enough to like make you like never eat lettuce for a little while, right?
Yeah, unfortunately, blame Taco Bell for a little bit.
We're not going to do that. Okay, we're not going to. No, sorry, Taco Bell. I don't want to hear from you later on.
It has nothing to do with Taco Bell. It's the lettuce and their suppliers, which don't just supply to one particular place. They supply to multiple places.
Well, that's great. That's making me feel real relaxed.
But there's always something. This just gets the media, and then all of a sudden it goes, and then people figure out, oh, what's cyclosporine? It's been around forever. It's self-limited. Most people just get diarrhea for a few days. You normally don't even have to treat it.
So then they won't need to come to you if they're having these constipation problems, right? So eat that tainted lettuce, right? Just go after that iceberg.
There you go. That's a treatment.
Okay, another statistic that's kind of scary. 1 in 24 men and 1 in 26 women will develop colorectal cancer, according to the American Cancer Society. Whoa.
Yeah, that's a lot. So
is this like just a new thing, or is it just because we have so much data now that we're able to pin that?
No.
Was it happening with my grandmother's grandmother kind of thing?
So it was happening back then, just not at the same rate. So it's happening more often. And it's recent. This is a recent thing in developed countries. So where we're seeing higher rates of colon cancer. And it goes back to all those possible reasons, processed meat. And then there are a lot of things that people are doing nowadays that we suspect are probably going to come out as something of concern. Vaping is one, for example.
Vaping, talk about that. Why? Because you said that twice already. Why is that connected to this cancer?
Well, we know tobacco is connected.
I would think of lungs or heart, COPD, asthma.
Yeah. So there are a lot of chemicals that damage DNA in burnt and processed substances. So they're called oxidizing substances that oxidize your DNA and cause damage and affect the replication and the copying of that DNA and make abnormal cells. When you vape, you are heating a chemical and then breathing it in. They tell you X, Y, and Z chemicals are in there, flavors and whatever, and I'm not sure exactly if they have to put all of them. But once you burn those chemicals and burn whatever it needs to be in, there are many other chemicals. So when people smoke and people think, oh, it's the nicotine that's bad, it's not the nicotine that's bad. Nicotine actually doesn't really do anything other than increase your blood pressure, clear your mind, and do some other positive things. But it can, increase your blood pressure and stuff. So that's the bad part. It's all the other stuff in the tobacco that gets burned up. You inhale it, that damages your DNA. So it's the filler that goes with the nicotine. And in the case of vaping, I suspect that there are many chemicals in there that we in the future will identify as possibly carcinogenic, just like we did with tobacco. And that may also be the case with the kind of cocktail craze that we have, where you have all these smoked cocktails. Like you have an old-fashioned, smoked old-fashioned.
They look so pretty, though.
They do. They're great.
But terrible for you.
But I try to not do it often. So, and that's the key to everything in life, right? It's balance. You don't want to have hot dogs every week. You don't want to have a smoked old-fashioned 2 or 3 times a week. And
don't vape.
And you don't want to. You may want to skip vaping.
Once or twice a week.
You may want to skip vaping altogether. There are a lot of studies coming out that vaping is pretty damaging.
I'm really good with that. Another statistic that really floored me. An estimated 60 to 70 million Americans are affected by digestive diseases each year.
Yeah. So, and that's a very broad statement. So digestive diseases can include gas bloat, which are very common symptoms, diarrhea, intermittently, urgency to use the restroom, nausea, abdominal pain, and then the more serious advanced diseases like Crohn's disease, ulcerative colitis, which are chronic conditions. So it is a very common ailment to include all GI tract issues. And so when I go somewhere and someone says there's a gastroenterologist, everyone turns around and has a question.
That's right. But like I said, you went down to the Keys. You opened yourself up for this, right?
Yes, sure did.
So for listeners right now in our audience, what would be one thing that you would want them to know about their gut health, about protecting the digestive system, and how GastroMed can fill that in for them?
So a real important thing is balance. You want a balanced diet. The diet that we recommend generally is Fruit and vegetable forward Mediterranean style diet with healthy fats, avocado oil, olive oil, fish, white lean meats, very little red meat.
And no barbecue.
Barbecue, very limited. 4th of July is fine. Okay. So, and the way that we at GastroMed try to help promote that is that at every visit, we kind of look at least we try to go and look at the whole person. It's not just your issues, but what is the psychology behind what's going on and why it is that you're complaining. So when we have that young woman who looks perfectly healthy, labs are normal, but they're having lots of GI symptoms, workup comes back normal, we have to take a step back and ask what's going on at home, even before we start, sometimes even before we do a test. And maybe a reason why not to do a test is we ask certain questions. And when we find out that there are certain things happening that may be the root cause and no alarm symptoms, we can pause, not do a $1 million workup and focus on those causes, psychiatric or whatever.
Psychiatric health, exercise?
So going back to health, seeing a specialist that can help with anxiety and stress. Maybe they're deeply depressed because they lost a loved one and for some reason they haven't connected it, that the symptoms started at the same time. And they need to address that before we jump into expensive and possibly slightly risky studies that in the end will be negative. And I can't tell you the number of times we have a patients come back. I decided not to do anything. We discussed that. We referred to a mental health specialist, or I myself started a medication that we use typically for IBS type symptoms that help over the course of 6 to 8 weeks. Have them come back. They feel great. We come off. We follow up one more time to make sure things are okay. And we didn't have to do anything. At least not on the GI side. And
it's so interesting. There's a book called Your Body Keeps the Score, and it really does. It knows everything that you've experienced, and it stores itself in our little guts at this situation for this interview purposes, isn't it? Mm-hmm. So if you want more information, it's gastromedmiami.com, or you can call 877-694-8837. I want to thank you for joining me today, and the information was incredible, and many different locations to reach out to you and your associates, and thank you so much for this time.
Thank you very much, Fara. Thank you for having me.
And I want to thank you for joining me today. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a great day.